Good morning. Here we are back at it. More practice questions for the lungs today. Helpful for Step 2 CK, IM Shelf, or IM COMAP, as well as many other different exams. Let's jump into it. As always, pause, answer the question for yourself. It's only helpful, these sessions, if you are actively testing yourself. So here we have a question. Go ahead and pause. Now I'll begin. Here we have a pregnant patient, 34 weeks gestation, presenting in the emergency department with a history of DVT, acute onset dyspnea, tachypnea, bilateral crackles. They give us her blood pressure, which is elevated, and her heart rate, respiratory rate. And it's asking, what's the cause of these symptoms? I hope when you see this vignette, you're thinking preeclampsia. With a pregnant woman and elevated blood pressure, it definitely points to preeclampsia. So I'm going to go ahead and highlight what's critical, and then I'll show you the answer, and then we'll talk about that association with preeclampsia. So between a pregnant woman, DVT, which really isn't too important in this case, elevated blood pressure with the pregnant woman is going to point us to pulmonary edema. The clinical findings of shortness of breath, severe hypertension, acute onset dyspnea, tachypnea, and bilateral crackles are indicative of pulmonary edema. In pregnancy, the most common cause of pulmonary edema is preeclampsia, a hypertensive disorder that typically occurs after 20 weeks gestation. Preeclampsia is characterized by new onset hypertension, systolic blood pressure greater than or equal to 140, and a diastolic blood pressure greater than 90, and end organ damage, which can include pulmonary edema. When they say end organ damage, it really just means you get symptoms of another organ. So that could be increased proteinuria, so elevated protein in the urine. It could be elevated creatinine, or in this case, the lung symptoms. It's just something else has changed in addition to their hypertension. And then to differentiate that from eclampsia, eclampsia is all those same things we saw in preeclampsia, but you add a seizure. So going through some of the other answer choices, other conditions like pneumonia or acute respiratory distress syndrome could present similar symptoms, but are less common in this context. Once again, it's going back to that association with pulmonary edema and preeclampsia. And as I mentioned earlier, although DVT is relevant to this patient's medical history, it's not the immediate cause of her symptoms. So in summary, the most likely cause of this pregnant woman's shortness of breath, hypertension, and acute respiratory symptoms at 34 weeks gestation is pulmonary edema, secondary to preeclampsia. It is significant concern due to the potential risks it poses to both the mother and the fetus. And generally speaking, when it comes to treatment of preeclampsia, it's delivery. And I added a little picture here just to illustrate some of the things associated with preeclampsia. So preeclampsia, you get that vasoconstriction of the vessels, it decreases their ability to breathe, fluid builds up, and sometimes you can even get HELP syndrome, the hemolysis, elevated liver enzymes, and low platelets. But in general, you're looking for problems with lungs, liver, kidney, which all signify end organ damage. So something along those lines with the elevated blood pressure. All right, as always, like and subscribe, and I'll see you in the next one.